Is that better? Okay, I apologize if this is boring. I like to look at numbers, so that's what I write about. Good. In the early days of March, when this all started, I felt pretty strongly that it was nothing more than just a really deadly virus like all the other ones that never killed us. Most tended to agree at that point, and then we started seeing some scary reports coming out of China and Italy of people dropping dead in the streets. At that time, I was still not all that worried about. I was not that worried, but I was prudent. I stayed home. I warned my mother, who just got back from a cruise, to not go to work and stay home. What she said, "I'm going to work, this is bullshit." But now she's scared and she's staying home. I'm very data oriented. I was a data analyst for a decade. I might also be a little obsessive compulsive. So I've been reading studies and looking at data from all over the world nonstop for about 9 months now. When the government came out early on and gave a best case scenario of 550 to 1,700 deaths in New Brunswick based on the 0 deaths at the time, I thought something looked a little odd and a little fishy. I started looking at Italy, since it was the place that everyone was pointing at. They hit about 35,000 deaths in the first wave. While this sounds horrible, Italy has one of the oldest populations in the world, and it's very common for them to see 25 to 30,000 flu deaths in a single season. Now, what is interesting about Italy is that starting February 21st, they took extreme lockdown measures. They started with mostly the affected cities. They had police blocking off roads to make sure people weren't moving from city to city. At this time, when they took this measure, they only had 1 death. By March 9th, they had grown to 600 deaths despite locking down all the major cities. I'll also add, Italy has 60 million people in it, just for context. So March 9th, they locked down the entire country with 600 deaths. They were considered to have the most strict lockdowns outside of communist China. They had military policing the streets to make sure people didn't leave their homes. Now, despite being locked down worse than communist China, they ended the first wave with 35,000 deaths. So did the lockdowns really work there? And they apparently think so, because now they're doing it again. So during the first wave, their highest one-day death count was 921 people. As of now, during the second wave, which the first lockdown should have stopped, the highest death rate for one day is 993 people. So I'd like to ask, what's that thing that they keep saying about the definition of insanity? Do the same thing over and over again, expect a different result. So Canada, sorry, I lost my spot. So we see the same thing all over the world, pretty much. Nearly every place that implemented lockdowns, they're seeing large second waves. It almost seems like the lighter the lockdowns a country did, the better the outcome in the second wave. Canada was not as tight with their lockdowns, but still used them. We're seeing deaths. We're seeing less deaths in the second wave than we saw the first wave, but we're still seeing a higher death count than many countries. One day peak in the first wave for Canada was 222 people. Now during the second wave, it's only 114, which is slightly better, but it's still bigger than most countries. We may not have seen the peak though, as if you look at our death curve, it's still on the rise and not yet on the decline, and we're seeing an average of 98 deaths per day right now. Now if we look at one of the most predominant non-lockdown countries, Sweden, Sweden didn't implement any lockdowns whatsoever. They simply trusted their citizens to do what they thought was right. They asked them to follow the time-honored guidelines that were in place over 4 decades that were developed by studies of pandemics, which was wash your hands, social distance, don't go out when you're sick, and if you do go out when you're sick, don't sneeze on people. Many said Sweden did it all wrong, and they paid for it with a high number of deaths in the first wave. While they did see a large number of deaths, they admit what they did wrong. They didn't properly protect their seniors' homes. That's where the majority of all the deaths took place, like they did everywhere else in the world. They corrected that problem, and they saw their death toll decline steadily and enjoyed about 6 months of almost no deaths whatsoever, the lowest in the world. Now, with their second wave, they actually do have a second wave. They got lots and lots of cases, but their deaths were really quite low. They hit an average, the highest one-day peak was 60 deaths, but they're already downward. Their trend is already coming down. Their wave is over. They're currently at a 3-day rolling average of 8 deaths per day. And they're not locking their citizens up. They're not making them wear masks. They're just letting them do what they think is right and take the risks that they think are reasonable for them and their families. It's amazing what a little bit of trust in your people will do. So 2 months. It took 2 months it took them to break their curve. They flattened it already, and they didn't have to do any of this stuff. So currently, in their second wave, they had just a little over 1,000 deaths, and they're back almost at baseline now. While Canada, currently in their second wave, is at 3,100 deaths and climbing. The fact of the matter is that there's no evidence for lockdowns. It's never been done before. There's no data on it, and there's no way to prove that it works or doesn't work. We have no control. We have no control group like in a controlled study to look at. That's the exact same places we are. So we don't know if it works or not. It makes it very easy for pro-lockdown advocates to simply say, if we didn't lock down, it would be worse. And there's no way to prove it. Anyone who says anything different is just a murderer who doesn't care about those that died or will die. Yes, we're all selfish. We know that isn't true. We all know we probably care the most of anybody. We care about our country as a whole. We care about the lives lost in despair and the poverty related to the people losing their livelihoods and the depression that comes with the isolation we are experiencing. We care about what this is doing to our freedoms.
Freedom!
This doesn't stop. This doesn't stop with masks and lockdowns. It never stops. Rarely when any government takes power over us do they ever give it back. We can't be silent. We can't let them make us prisoners in our own country. Just to end things, I just want to give some stats on how deadly this has been in New Brunswick compared to the flu. So Dr. Jenny tells us right now that as few as 8 COVID patients could overwhelm the system. We've not seen any flu this year yet. In 1 week in 2018, we saw 54 hospitalizations and 9 deaths just from the flu. Aren't we lucky that this isn't this year? What would happen if we had 54 hospitalizations right now when 8 COVID patients could ruin our entire system? So this is really reflective of what's going on here right now. It's not a deadly virus that's a problem. It's clearly a mismanagement of our healthcare system. Yeah. If 8 people can overwhelm the system in a normal flu year, we have 50 hospitalizations, there's definitely something wrong, and it's not COVID. So just a little bit more stats for you. From May 3rd to July 18th this year, we had 6 deaths from influenza. That was during the first wave of COVID. 6 deaths. During that time, we had 1 COVID death. So how did it that the measures in place stopped COVID in its tracks, but did nothing for the flu whatsoever? I've yet to get an answer. I've emailed Doc Jenny and Grampy Higgs many times, and they've never responded to me. That's the end of the stats. But just one more thing. I want to talk a little bit about Dominic Carty. I know everybody loves Dominic Carty. I like to get the crowd cheering before I go. One last thing. So we're going to talk about Dominic Carty. So on his last appearance on the COVID show, he said that people are lying on social media and that we should only listen to people that are held legally accountable for the things they say, like the government. He then went on to say that only 4 tickets have been given out for masks and we should stop complaining about it. It's not like they're the Gestapo. Well, Mr. Carty, somebody's lying here because they're on the CTV the other night. They were saying 87 mask fines have been given out so far. That's a little more than 4. I'm not, the best mathematician in the world, but it seems like more. And if you do the math on that, that's $25,000 in fines for average New Brunswickers that are trying to feed their families for not putting on a mask correctly, some of them, or for being exempt from wearing a mask and they still have to put one on according to the mandate. So something that doesn't have a shred of scientific evidence to support it, such as mass, it's pretty costly. So I think it's clear who can be trusted and who cannot, and it certainly is in Mr. Carty.
Did you say Gestapo?
Yeah, the Gestapo, yeah. Brown shirt.
Thank you.